Okay, welcome everyone. Today we will be diving into an essential yet often overlooked topic, pelvic floor health during perimenopause and menopause. Joining us are two incredibly passionate pelvic physio advocates dedicated to empowering women with the knowledge they need at every stage of life. Welcome Dr. Kiana Berry and Heather Marra. And I'd love for you guys to each introduce yourselves. So, Heather, go ahead.
Yes, thank you. It is so good to have this conversation. It's so important. I have been a pelvic floor physical therapist for 25 years. When I was in PT school, we got about 2 or 3 hours on pelvic health, and I knew I wanted to go into it. So right away, I went in and specialized in this area. And then I have started my business, One Simple Step, where I provide mobile pelvic floor physical therapy to women in their homes. I go to women and I make it even easier. And I also see women virtually, and I'm in the state of Kentucky, outside of Lexington, Kentucky. So
Wow. Well, welcome. Thanks for
thank
being
you.
here.
Uh-huh.
And Dr. Barry, go ahead.
Yes, yeah, thank you so much for having me, Marty. And I'm Dr. Kiana Berry. I'm actually currently in Charlotte, North Carolina. I'm a pelvic floor physical therapist. And something interesting is that even before I jumped into pelvic floor physical therapy, I was using it with my aquatic patients, orthopedic, pain science, all of that. And I have a company called Vagina Plus Me. And I have an online virtual company where I do coaching virtually all around the world, so internationally, for people who primarily have sexual pain, vaginismus, vulvodynia, pelvic floor dysfunction, all the like. And one of my biggest passions is to empower people to know that they have the tools to be able to thrive in their life and understand that they're not broken.
Yeah, that's great. And
Mhm.
I think for women, because today we're really going to dive into
Mhm.
perimenopause and menopause, I think it's a difficult one because people don't really know what to expect and what's happening to their body because there's such little education around it. So today I think
Mhm.
it's going to be a great opportunity for people to understand, for women who are going in this, who are in this stage to understand what their bodies are going through and how pelvic PT can help and how, certain products can help as well. So welcome. Thanks for being here. And so we'll start off just talking about how menopause can impact pelvic floor health and what symptoms should women be aware of during this period, during this
Definitely.
transition.
So let's take a big picture at this, because a lot of women say, well, where am I? I don't even know where I am in the menopause transition. So average age of menopause is 51. Perimenopause can be 2 to 10 years prior to that. Some of the signs could be irregular periods. Your estrogen may be going up and down. Then when you have 1 full year of no periods, that's menopause. And then after that is postmenopause. And then a lot of women, it's very common. A lot of people say, oh, there's 30 symptoms of menopause. And actually, our friend found that there are 103 symptoms of menopause. So that opens up even a bigger box here. And then there are musculoskeletal symptoms, musculoskeletal syndromes of menopause. And that could be frozen shoulder, thinking about osteoporosis, muscle loss, things like that, joint pain because of the estrogen drop. But what we're going to focus on today is more of the genitourinary syndrome of menopause, which is because of the vaginal changes. So there could be vaginal atrophy or thinning of the tissue, pain with sex, more UTIs because the pH changes, urinary incontinence, frequency, getting up at night. So a lot of these things are happening. And I think sometimes women are caught by surprise and just, oh, that's part of aging and we give up. But there's so much that we can do with pelvic floor physical therapy through menopause so that we can counter a lot of these symptoms.
I think a lot of people don't know that, right? Like they're thinking, how can pelvic PT help with atrophy? Or how
Yeah.
can pelvic PT help me with, um, the anxiety I'm feeling around not being able to have
Mhm.
sex?
Mhm.
So I think it's really great that you guys are here today to really explain how pelvic PT can benefit.
Yeah. And it's unfortunate because most people don't know the signs until they're already progressed. A lot of people don't even realize with perimenopause, it can start earlier than you even think. It could start at 39. Some people who go through chemotherapy, radiation, or get a hysterectomy may go through early perimenopause. And
Mhm.
so understanding the signs and understanding that there's a treatment approach to it can move wonders, and it can actually really help people have hope. I think that's a biggest thing because a lot of times or society has said, oh, this is just normal. Like you should just expect that this is going to happen and deal with it. And we don't have to do that anymore at all.
Mhm. So what would you normally do with a patient who comes in and is complaining of, you said 101 symptoms, but some of the symptoms that you guys address?
With an evaluation, we assess the pelvic floor. As pelvic floor PTs, I think we have a pretty awesome career. I mean, we actually assess those muscles externally and internally. We actually work internally, vaginally, and rectally. And we're looking for scar tissue, restrictions, tightness, pain, and then assessing what the tissue looks like. Because with that drop of estrogen, sometimes there's a thinning, almost like cigarette paper is an analogy that is commonly used. And so then that conversation, we assess how's the mobility of the muscles? How's the strength? Is there a prolapse where the vaginal walls are a little bit more lax? You might have a heaviness there. And then also assessing to instructing on lubricants, vaginal moisturizers, or even vaginal estrogen cream. Because if we can put estrogen back in the vaginal area, that makes a world of difference. And it makes the bladder happy too. So helping women with exercises and stretches, but also conversations to know what can I do proactively to feel better in this last half of my life.
Yeah, absolutely. And I agree with Heather. I love our career because it's so holistic. And we're not just looking at just the pelvis. You know, there are other parts of menopause like bone density, general muscle fatigue, sleep issues. So you also want to assess the person's lifestyle, their habits, and also other things that could be compounding on their pelvic floor, like their posture, like their shoulder stability, like small habits that they thought were normal, like sneezing on the toilet or putting their toes up while they're on the toilet, or I never had to use lubricants before in my life. Why do I have to do it now? So I think that it's so much more deeper than just pelvic floor. It's the whole life. It doesn't just affect one thing, it affects so many other areas that will compound on the issue. So I love that we can approach a person and see them not just for their pelvis, but their entire life, them as a human. Like, how do those decisions impact you now that you're going through perimenopause or menopause? And how can you thrive and feel even better than you did before? So it's very empowering and it's very holistic and it really does change lives.
Amazing. So what are there some specific stretches that you recommend for this population?
Yes, yes. So once we finish our assessment, because everyone's a little bit different, we want to really see what specific exercises could help because everyone's different. Some people may have needs that some exercises and certain stretches won't actually help them with. If we notice that the vaginal walls are a little bit more fragile, the integrity is a little bit off, we want to think of a few things like building more circulation, right? Helping a little bit more lubrication, engaging those core and those glute muscles to help support the pelvic floor from the outside in and the pelvic floor from the inside out. A lot of people think, oh, Kegels, Kegels, that's all you have to do. That's not necessarily true. And I'm sure Heather can answer that too, because throughout history, everyone said Kegels will change everything, and they can change some things, but if they're not done properly and with the right treatment plan, it's not going to change the world.
And if you have a hypertonic pelvic floor, then they're going to be
Exactly.
detrimental. So I never understood that. It frustrates
Hmm.
me to no end. When hypertonic pelvic floor,
Hmm.
GPs are saying, "Oh, do Kegels. I hear that helps."
Yeah,
And people
exactly.
have the
A lot of
overactive.
people think you just lose strength and it's just weak, but you also may lose elasticity.
Mhm.
And if you're losing elasticity and you're getting some tense areas, or if you lost that recoil and some areas are straining more than others, it's not that it's tight, it's actually that it's just straining under this load. There's a tensile strain. There are a lot of different approaches that you can go to treat that.
And is there a lot of homework that women go home with?
The evaluation, we're teaching automatically. We have our pelvic
Mhm.
model and understanding. And then what are you doing day to day? Like walking women through, oh, yes, I have the pain when I do this, or I have a heaviness with this. So then we're already thinking holistically, how can I change my lifestyle? How do I pick up my grandkids differently? How do I work out in the gym differently? And so then starting with breathing and stretching, again, it might be more of an inner thigh stretch or it might be more internally. We do some vaginal stretching, which you can do with yourself. You can do it with a finger, a partner, a pelvic wand, or even dilators. So
Mhm.
every individual needs a different home exercise program. So that's the uniqueness about every single visit.
Mhm. Let's talk about dilators. We all know that a lot of women who struggle with vaginismus use them, but how would they be helpful for someone who's struggling with GSM symptoms, genital syndrome, menopause, genital urinary syndrome of menopause?
Mhm. Yeah, so many women experience vaginal dryness. That's something that you hear often, right? When you have that drop of estrogen. Many people experience tightness or tension or just does not feel comfortable and they experience pain. They might even experience pain for the first time in their life and they don't know what to do. They feel like their body is completely betraying them. And there are many things you can do, but their dilators are a really handy tool to be able to really address all those things. Now, I have here the in motion dilator, and here's like a normal dilator. And the difference with the two, this normal dilator, what we would usually tell my patients is to gently kind of place it in the tip. And I never tell people just push it in and leave it at all. You want to actually stretch, stimulate that tissue, and you would do this manually. With this specific one, I do like V-Well's in motion dilators because they have these rotating pellets that will
Hmm.
actually do the massage for you so you don't have to do as much.
Oh,
And I'm not moving that, it's just kind of spinning on my finger. It's not vibrating, it's actually massaging. And so
wow.
what this would do is it would massage those vaginal walls. It would bring in circulation. It would desensitize some angry nerves that may not have as much oxygenated blood. It would bring a little bit more lubrication to the skin tissue. And you don't have to do as much because it's actually massaging from the inside out. So that's something that you can use. Most people don't even realize pelvic wands exist. And pelvic wands, think of it like a foam roller for your vagina,
Mhm.
if you will. I don't know if you've ever heard of that like analogy,
I like
but
that.
think of it like a little tool where you can actually go in and stretch areas that you can't reach very well with just a normal dilator. So there's so many options and so many tools to be able to address these things outside of just let me just deal with it and let me just stretch. I really also like the idea that you can use an estroidal cream with the dilator. What do you think, Heather?
Yes, exactly, because it
Mhm.
massages in, and no
Yes.
one really instructed women how to apply that vaginal estrogen
Mhm.
cream. A lot of times it's like, here, put it in. And a lot of times our conversations are, wait, wait, wait. There's a whole way to work it into the tissues because I tell my women, it's almost like a wet willy that you want to put it in
Mhm.
side and then it goes to the bladder. which will help with some of your UTIs or urinary frequency, incontinence, that type of thing, and use it on the outside, the vulvar tissues, because everybody wants estrogen. But like you said, you can use it with the dilator at the same time,
Yeah.
and it just works and massages it in.
Into the tissues. Yeah, most people, I think some people are a little bit averse to putting something inside their vaginal entrance. And also, many people aren't even educated on what to do. A lot of people think it just goes on the outside and that's it. And they're wondering, why am I still having bladder issues? Like, well, this is not working for me. So, empowering people with knowledge is actually going to change their experience through this period of time. It can be night and day. So if you just use like a normal dilator, you can still work that estroidal cream into all of the tissues from more superficial to deeper. Because when you think about your pelvic floor, it's not just one area. I like to tell my patients that they can imagine the pelvic floor like a hammock. I think, have you used that too, Heather?
Yep.
Like the analogy?
Yes,
Like it's a hammock,
definitely.
and your bladder, your uterus, and your rectum are all resting in it. And when you have that drop in estrogen, you also can have a drop in skin integrity. Those muscles may weaken, and that hammock may become not as stable and not as strong. So, just like we talked about the estroidal cream, stretches, circulation, pelvic floor strengthening exercises, all of that is to help that hammock become more stable. And you won't be able to get all in there if you don't apply it correctly, the steroidal cream, and if you don't address deeper pelvic floor muscles as well. So it's so much more than just, oh, I think I have some dryness. It can affect a lot of other systems as well.
What's an applicator?
And what's interesting about the vaginal estrogen cream is my women are like, oh my goodness, like it looks plumper down there. It actually changes it.
Yes.
Um, like I didn't know that was possible. And even the
Mm-hmm.
color comes back. So there's so many different aspects that really make it important to have that discussion. Do you need a lubricant? Do you need a vaginal moisturizer or a vaginal estrogen cream or a combination of all three? Because a vaginal moisturizer is almost like chapstick for the lips down there. You take a shower and then you just put on a vaginal moisturizer, which can come in more of a thick cream or more of a liquid. So you can choose whichever. But then women feel, like you said, more empowered. Oh, this is what I need. And this is how I apply it. And we get to be with women and patients for like an hour. So we're not rushed like your doctor's visit. And then we can dig deeper. And then as we're talking about like pain with sex, are you breathing? What positions are you in? Do we incorporate the partner? Or some women have said, no, this is my thing. I need to use the pelvic wand. I need to use a dilator. Or other times, my partner's involved. And so we adapt each treatment according to the wishes of each person to really achieve that goal of pain-free and enjoyable intimacy, which I don't think everybody understands that we can help women achieve orgasms or men as well. But that intimacy that is incredible, that there's so many aspects that are you delve into, and breathing, contraction, position, all these things that we can talk to people and get them to the point of this is my pelvic health goal.
I love that you guys mentioned though that the dilator can be used as sort of this, application for and I feel like so many women are probably they have no idea what to do with the cream and they don't know how far they can insert it and what's safe and what's not. So it's really great that we're educating women right now about using a dilator to insert estradiol cream. I think it's amazing. Because I wouldn't have known that. I mean, that's a really great little tool to know that you can use a dilator to insert cream, and you're basically killing two birds with one stone because you're accomplishing a lot at one time as opposed to just using your finger and inserting the cream. you're actually massaging the muscles and, like you said, the tissues. And so that's a really great little tidbit of information. So
Mhm.
thanks for sharing that. I think a lot of
Yeah.
women are going to feel, great knowing that they can sort of use dilators to apply. And I think a lot of women just, in this period, in this transition, are not aware of what dilators can do for them.
Yeah.
They're probably thinking, oh, those are for people who have pain with sex. And of course, pain with sex comes along with, atrophy and whatnot. So, but it's sort of been, I feel, tailored to a group of women who are struggling with things like vaginismus and vulvodynia, and
Yeah.
women in menopause not or in peri not realizing that how beneficial dilators can be for them too, and helping them with
I
their
agree.
sex life. Yeah. So
Mhm.
thanks for bringing that up. How can women take a proactive approach aside from pelvic floor exercises to maintain their pelvic health when they're in perimenopause, aside from obviously what we've discussed? Is there anything else
Yes.
that you would add on top of
Yes.
obviously the
There, I
training?
love this question because I tell people, they always ask, so when can I start? And I always tell them there are some things you can do right now that can actually help your pelvic floor. And you don't even have to just address the pelvic floor. I always tell people that staying active is so important. And especially for perimenopause and menopause, it's very important to make sure that you are staying active to maintain your muscle mass, to make sure that your bone density is staying well and you don't actually have a reduction in bone density. Telling people to just go on a walk can actually do wonders for your pelvic floor and for everything, for your breathing, just like Heather talked about, your diaphragm, getting those endorphins, blood circulation, bringing oxygenated blood down into your pelvic floor, all the way up. So just walking and going on a walk and making sure that you are breathing not shallowly in your shoulders, but actually breathing through your diaphragm during that walk can actually be the thing that improves circulation down there.
Mm,
So I always tell people you can absolutely just be active. A lot of people are maybe a little bit intimidated by weight training, but weight training is going to make sure that your core, your glutes, your bone density is staying in the healthy realm. And it does not have to be powerlifting at all. Just pick up a few weights or maybe gradually, safely progress. If you've never done weight training before, have someone teach you. But that's actually a really great way to maintain healthy hip and pelvic muscles so that your pelvic floor can actually feel stable from the inside out. So I always recommend people to get active. Just like Heather talked about, like the vulvar balm, just moisturizing that area so that those nerves aren't getting hypersensitive. They're not feeling like it's, a desert down there.
mhm.
Just using a little topical moisturizer after you get out the shower, or even if you've gone to the gym, you're sweating, you take a shower, put the Vola Balm. It's a form of self-care. It's a form of pouring back into your body. So I love encouraging people to do things that pours into their physical self and their mental health and emotional health, where their body will just give them like a big hug, like, thank you so much. We're both going through this together. Thank you so much for holding my hand and pouring back into your own body. I find that a lot of women, especially who have gone through life where they have children, they're going to perimenopause, they're going to menopause, it's so easy to give to others. And
Mhm.
sometimes it's hard to pour back into yourself. And you actually are suffering so much more, and you can't give more if you don't have anything. So pouring into yourself, doing self-care, working on your sleep habits because sleep disruptions is a thing in menopause.
Mhm.
Working on making sure that you're getting your vitamins and your minerals and you're drinking the water and you're taking that breath that you very much deserve can actually do wonders for your nervous system and wonders for your body.
It's a huge life transition. It really is.
Yes.
And I don't think, and it frustrates me so much, I say this all the time that there is no education around it and people are going in blind. It's absolutely insane.
Yeah.
When you said something like 101 symptoms, and I see in the support groups how much of an outpouring there is of just people just so frustrated and so much negative around it too, right? Like we're just going into this period of life where we should be, a lot of people are potentially retiring. It should be a time to enjoy. And then they're dealing with all these
Yeah.
wretched symptoms that are just being such disruptors in their lives. So I feel like there needs to be more of we have to sort of come up with a way to um, approach menopause with a bit more of a positive attitude. We're going to go through it. Um, and right now it's over a billion women are in perimenopause or menopause now. So it's a massive part of our population, and it should be represented and seen in a positive light. So hopefully there's going to be change coming soon, and more people talking about it and more people educating about it. And I'd love to see education in schools for kids at the middle school age when they're being educated about puberty and going through getting their periods, so that they learn about that. There's no reason why they shouldn't be learning about the perimenopause
Mhm.
transition and menopause.
I couldn't I couldn't agree more. I totally wholeheartedly like let's talk about perimenopause and menopause. Let's talk about premenopause. So now we're thinking about this in our 20s and 30s.
Mhm.
What can I do? You can do
To
so many
prepare.
things, but I
So
wasn't
many.
thinking about menopause in
No.
my 20s and 30s. And now I'm 49, so I'm turning 50 this year, and I'm reading outcome up or most recent research that's coming out. And it's pretty amazing what they're saying and changing. And so, like the weighted vest, that's something that I've implemented and I started wearing it 5 to 10% of your body weight. As I was digging deeper with my healthcare, I was taking supplements and then noticing my irritability because, again, menopause can be isolating, anxiety,
Yeah.
depression, emotional
Mhm.
aspects. It weighs on us. Something is wrong with me. And then my doctor said, "Well, it sounds like you're knocking on the door of menopause." And I'm like, "What?" And so my sleep was being disturbed. Like you were saying, you can't sleep, and that changes everything. So I've started doing a nano serum that's topical of estrogen and progesterone. I do a pump in the morning of estrogen and one at night, of progesterone. And I'm sleeping 8, 9 hours solid. I feel
Oh,
energized. I feel alive. I'm doing wall Pilates. I'm working on, I mean, it's just like I'm really pushing the protein and the fiber. Again,
yes.
if we're not getting enough fiber, we're constipated. When we're
Mhm.
constipated, we're pushing down and bearing down, and that's hard on the
Mhm.
pelvic floor. We got to know how we teach. Kiana and I teach women how to pee and poop and have sex.
Every day.
That's what we're doing.
Yep,
So
very
I'm
important.
walking through this right now, and really, can we see this as the second spring? How can you be a strong old woman? I
Mhm.
think, we think about maybe our moms and our grandmas being frail, and let's change that. Let's
Yeah.
be strong old women.
But it's
And
not even
it
old,
happens
right?
today.
It's
Do
not
what?
even old because we're going through it. Like you said, it can start as early as 39 when we're going through perimenopause.
Yeah.
And so that's the other thing. Like you think menopause old. I think we need to get rid of that too. The
Yeah.
thing is, the the HRT piece is, there was a study in the 90s, and then people were scared of it because there was a study showing that it could be correlated with breast cancer. Anyways, that's been put aside, and more people are turning to HRT now more than ever before, and it
Mhm.
really does help. And when you think about it, I mean, back in the day, people only lived into their 40s, and so they didn't go through menopause. There was no estrogen reduction. Are we supposed to live, for as long as we do now and not live with estrogen? I don't think so. I think women need it, clearly. And progesterone is showing to have a lot of benefit as well. So clearly, hormone replacement therapy is potentially a necessity. Uh,
Mhm.
that I think people are starting, and I don't know if you've both seen the M factor, but they were discussing how important HRT is and how it can totally turn women around in this period of life. So it's just it's a hard one, right? Because we're finally sort of accepting this HRT. Women are openly talking about using it now, whereas it used to be, oh my God, use HRT. Aren't you worried about getting cancer? And now that's sort of, not happening. And the women who do have, there are risks for them to take it, they don't take it and they look at alternatives. But, it's a very important conversation to have. Um, and I don't know if that's one that you guys are having with your patients, but I think it really is something that we need to address and become more comfortable with for women who aren't comfortable with it yet. Um, yeah.
Yes. I think we definitely, I think we talk with our women about it just so that they're informed and then they can have the informed discussion with their provider and figure
Mhm.
out what is right because everybody's journey through menopause is going to be unique and your needs are going to be completely unique.
Mhm.
But even dispelling those myths from that Women's Health Initiative study from 2002, and really it was an increase of one case from 3 to 4 cases of
Mhm.
breast cancer per 1,000 women. But
Mhm.
you didn't look at all the other benefits of dropping cardiovascular disease, dementia.
Mhm.
Estrogen affects everything.
It really
And
does.
now they're realizing maybe we should have been putting more women on estrogen. And now instead of HRT, it's even MHT. So they've even changed the name to menopause hormone therapy
Mhm.
to change that. Are you finding the same thing, Kiana?
I agree with you that there's a lot of misinformation. And I think that a lot of women, whenever they're moving to this, there's a lot of fear of, will this affect me this way? I don't know if I should, go into this. Should I do naturopathic? Because there's so much misinformation out there, I think that it can really put people in a freeze state of, I don't know what to do with my body. Maybe I just have to live with this forever. So we are very big advocates for women's health. We spend so much time with women, with their thoughts, their concerns, and with their bodies. And we see it real time, women's lives going from I'm afraid to I'm so confident in my body and I know exactly what to do with it. Heather brought up a really great topic about even diet. A lot of people don't realize that nutrition is so incredibly important for the changes in menopause and perimenopause. Making sure that you get that amount of protein that you need on a daily basis, making sure that you're eating that fiber, making sure that you take those vitamin D3, omega-3 fatty acids, making sure even fish oils, making sure that your nutrition is good because you can be as active as you want, but if your body isn't being fed
Mhm.
correctly, right? And you're stressing your body out without those nutrients, your hormones can actually get very angry with you. Your body can get very angry with you. So understanding that it's not just about physical side, but we want to make sure that that nutritional aspect is just as important because it's what you put in your body to feed it. So I completely agree with you, Heather. We're big advocates for not only empowering people with information, dispelling myths, and making women not feel afraid of their bodies and how it's changing, but feel even more confident than they were before.
Mhm. Yes. And that's what I was saying, like having a more positive outlook when going
Mhm.
through this period, not having this negative, oh my God, I'm approaching perimenopause.
Yeah.
And a lot of people do actually want to go in with a blind eye, they just want to turn a blind eye and say, we'll see what happens. Some
Mhm.
people, go through it and it's not so bad. Some people go through it and it's can be very life changing. So, yeah, I think there's, a lot of work to be done. And with such a large number of people who struggle with symptoms, I think we need to have a louder voice.
Mhm.
So,
I agree.
so thank you so much for coming on today. This has been great and I think going to be extremely helpful for our viewers. And if you have anything else to say, now's the time, and we will hopefully be on again together soon.
Definitely. Well, follow us. Kiana and I both are active on Instagram. Mine is One Simple Step Today. Kiana, yours is.
Mine is vagina plus me. Very straightforward. So V vagina PLUSME on Instagram and
Mhm.
TikTok. Now that's here.
And thanks to Into MD for sponsoring the Be Well, which is seems like an absolutely
Hmm.
incredible product, which I'm gonna post in the comments as well so that people can um, purchase it.
Yep. And there's different sizes, which I really like
Oh,
because
that's great.
sometimes the purple one might be a little bit too intimidating.
Mm.
So this is the smallest one that does rotate.
Hmm.
And it also comes with two others that don't rotate. So if you want to start a little bit slow and then build up to these, I like that there's something for everyone wherever they are in their journey.
Hmm. That's great. I love it. Well, thank
And
you.
don't forget to go see a pelvic floor physical therapist. I wish everybody was seeing them, just like you see your doctor and your
Yep.
dentist.
Mm-hmm.
Like you don't realize the things that we can improve. You're like, this is good, but life can even be better.
Better. Mm-hmm.
Hmm. And that's really, really important. I think, people who don't have issues or don't even know what a pelvic floor is, which is often the case, when you actually discover how much falls under that hammock, as you were saying,
Yeah. Yeah.
um, you'll be glad you went and saw a pelvic PT. So thank you guys.
Thank you.
Thank you.
Okay,
Thank you for having us.
absolutely.